And welcome to another titillating episode of Scissors and Scrubs. I'm Nicole.
I'm Laura.
This week we're going to discuss AVMs and brain aneurysms. AVMs, I'll explain what those are in a minute. And we're going to follow it with a story from Nicole, who had a brain aneurysm after pregnancy. And it's quite a story. She's going to get into what happened and how she recovered and just weird things that are happening to her still 10 years out. It's an amazing story, and I think you might enjoy it.
Yeah.
So we're going to get a little technical first. AVMs. I'm going to go with AVMs.
Okay.
I don't know why, but it makes me think of cars. AVMs.
I don't know why.
I don't know either. Okay, so I got all my information from Mayo Clinic.
Okay.
And what is an AVM, Laura?
Arterial venous malformation.
You are so smart. She's wicked smart. It is an abnormal tangle of blood vessels connecting arteries and veins, which disrupt blood flow and oxygenation. And if you look at it, it looks like a big, almost grapes. Like it's just a big jumble of shit. It's just, you can't even, if you took a bunch of necklaces and you tied them all together to a big knot, that's what it looks like.
It took me 3 hours to untangle all my
When I moved my aunt yesterday, she loves her jewelry, but she's got dementia. And so there's about 4 necklaces in the size of a tennis ball. And she's doing nothing but sitting there. I'm like, why don't you do this?
Yeah.
And she's like, yeah, no, I'm not doing this. And she just put it back aside. I'm like, okay, so they'll stay that way.
Yeah.
Okay, so when you have an abnormal tangle of blood vessels that disrupt the blood flow of oxygen, it causes the surrounding tissues to not get enough oxygen. And in your brain, that's really bad. So all these tangled up blood vessels are weak, and they can rupture, causing a stroke or brain damage. So the symptoms, I'm going to go through signs and symptoms and all that. They're going to be very similar to aneurysm because a brain bleed is brain bleed, no matter how it's causing. And you'll hear the difference between an AVM and an aneurysm, but they're almost, when they surgically treat them, they're almost treated similar. Yeah. All right. So the cause of an AVM is unknown, and it's not thought to be hereditary, even though if I were to have an AVM, all my kids would have to be tested for one. The symptoms are based on the location of where they are. And the first symptom of an AVM is often when it hemorrhages. Most people who walk around AVMs have no idea that they have it. It can cause a progressive loss of neurological function, headaches, nausea, vomiting, seizures, and loss of consciousness. You will also have muscle weakness. You can have it it's almost like a stroke. Muscle weaknesses, paralysis on one side, loss of coordination or walking. You can't perform simple tasks. Weaknesses in your lower extremities, back pain, dizziness, vision problems. You can have loss of control of your eye movements because it's affecting the optic nerve. You can have swelling of the optic nerve. You can have problems speaking and problems understanding what people are saying to you. Sudden numbness, tingling, or sudden pain. Memory loss, hallucinations, confusion. Again, all of this can be very similar to if you're having a stroke, because when you're bleeding into the brain, a stroke is bleeding into the brain. An AVM is bleeding to the brain. And they're all bleeding into your brain, so it causes all the very similar symptoms. If you have a vein of Galen, that's an AVM that appears shortly after birth. It's deep inside the brain on a baby, and it's these babies will get hydrocephalus. Hydrocephalus is when the babies get the really big heads because they have so much fluid in there. You'll have swollen veins on the scalp. They'll have seizures. They'll have failure to thrive, and they can get congestive heart failure. So, how do you know when you have an AVM? Well, you go in for something completely unrelated. They do a brain scan, and they're like, oh, shit, you've got an AVM.
Right.
So, even though it's not hereditary, you have a risk factor if you have a family member who has had this. There are certain hereditary traits like hemorrhagic telangiectasia. I know this word, but I can't get it out. And Osler-Weber-Rondeau syndrome. They increase you. Don't ask me what that is. That's another episode. It increases your risk of having an AVM. Complications of an AVM are bleeding and seizures. And if you do not treat the bleeding, like you blow your AVM and you're out in the middle of fucking Yellowstone and you can't get to hospital, you could get significant brain damage or it could kill you. So, how do you diagnose an AVM? You can have a cerebral angiogram. They're going to put a little poke in your femoral artery. They're going to shoot dye up into your head, and it will
take a picture.
It'll take a picture of all your vasculature in your head, and it'll say, "Oh yeah, there's an AVM." You can have a CT scan or an MRI. So let's say we have a little angio or we have an MRI. There's a huge fucking AVM in the middle of my head. What am I going to do? Well, that depends on my age, my health, the size of the AVM, because they can be very big, and where it is located. Location, not only in real estate. Surgery is most common treatment. An AVM resection, it's only done for low-risk AVMs surgically. Yeah. You can do an endovascular embolization or a stereotactic radiosurgery. Obviously, surgical, you're going to go in, you're going to pull a flap, you're going to go in, and they're going to take clips, and they clip it. Do they cut it out, or do they just clip it when they do it surgically?
The AVM, they might take it out. I don't know.
I think they take it out. Yeah. I haven't seen them. So they go in with the same things they clip an aneurysm with. They have AVM clips, they clip it, and so it won't bleed anymore. If they go in endovascular embolization, they go in through the groin like they do a cerebral angiogram. And they will coil. They'll throw coils into it to prevent it from bleeding. Stereotactic radiosurgery is done for an AVM that's in a really dangerous place. They can't really, they're not going to risk going in surgically because it's going to create more problem. So even though there's no cuts into the body, they consider it still surgical. And small AVMs, those that are difficult to remove, they go in and they focus radiation strictly at the AVM to kind of fry it up. So if you have an AVM and you are waiting on treatment, they want you to avoid activities that will raise blood pressure or put a strain on an AVM. You can't take laxatives. You don't want to get constipated and be pushing in that toilet and blow an AVM. It has happened. Yeah. Okay. I'm not saying this as a joke. It has happened. No heavy lifting, no blood thinners, because blood thinners can cause it to bleed. So if you find you have it, it's not a death sentence. You can go and you can get treatment for it. There's 3 different ways. Hopefully it's not a place that's too traumatizing. And you can get it taken care of. Right. On to aneurysms.
All right. I got my information from nhs.uk.org and Mayo Clinic. An aneurysm is a ballooning in a blood vessel. You can have them in any vessel in your whole body. A brain aneurysm is a ballooning or bulging of a blood vessel in your brain.
It literally looks like a little itty bitty tiny balloon.
Yeah, people say they look like a berry on a stem because the stem is the rest of your blood vessel, and then there's like a berry on it, which is the aneurysm. They develop as a result of thinning artery walls. They can occur anywhere, but usually they form at the forks of your branches. Like, so a vessel will branch, and at that little fork, like that little intersection, that's where they usually form because it's just weaker there. And they can occur anywhere in your brain, but it's most common at the base of your brain. Most brain aneurysms don't rupture. But most brain aneurysms do not rupture. They do not create health problems, and they do not cause symptoms most of the time. Those aneurysms are usually found only when testing for other conditions. Like, I was in a car accident, I hit my head, they take a CAT scan, they're like, oh, hey, you have an aneurysm.
They tested my aunt for something else in her 70s, and she had a brain aneurysm. Yeah. And we had it scanned till she was 88 or something, and they were like, okay, you're going to die of old age, but she's still alive. Yeah. Before the brain aneurysm was going to rush her. My other aunt went in, found one in her. So sure, if my mother's 1 of 12. I'm sure if they went in, I'd be interesting to see, but they all were popping up with brain aneurysms, but they all lived.
Doctors may want to treat an unruptured aneurysm preventatively if it's causing symptoms or to prevent a future rupture. Some symptoms an unruptured brain aneurysm cause are pain above or behind one eye, a dilated pupil on one side, change in vision or double vision, and numbness on one side of the face. This is usually because the aneurysm is large, and it's pushing on the brain tissue and the nerves in that area. If it's small, it's probably not going to cause any symptoms. Aneurysms can also, quote unquote, leak. A leaky aneurysm leaks a small amount of blood that can cause a sudden, extremely severe headache. If you get a sudden, extremely severe headache,
never a good sign.
Go to the hospital. A more severe rupture often follows the leaking. So if it's starting to leak, you got to get it taken care of. A ruptured aneurysm is a medical emergency. It is a life or death situation. It causes bleeding into the brain, which is also called a hemorrhagic stroke. So people get confused with this because most people, I think of strokes as clotting, which a stroke, it's an ischemic stroke is when you have a clot in your brain.
Strokes, right.
A hemorrhagic stroke is when you have a bleed in your brain. It causes the same thing, death to the surrounding tissue, just from two different things.
Mechanisms.
Yep. Usually they occur between the brain and the dura, which is like that thin little layer on top of your brain, which results in a subarachnoid hemorrhage. A subarachnoid hemorrhage, whether it's from a hemorrhagic stroke or from hitting your head or whatever, is a life-threatening emergency. It puts the pressure of the blood being trapped between that layer and your brain causes the cells around that area to die. So then you get brain damage. Your brain starts to die. Yeah. It causes swelling. It can cause brain herniation. It can kill you. Symptoms of a rupture. Sudden, severe, quote unquote, the worst headache of my life is the hallmark sign.
That is literally what everybody says. I had the worst headache of my life.
Hallmark sign of a aneurysm rupture. Other symptoms: nausea and vomiting, stiff neck, blur or doubled vision, sensitivity to light, seizure, drooping eyelid, loss of consciousness, and confusion. Complications after a rupture. So you have a bleed, you have a rupture, you're bleeding. They take care of it. This stuff happens after that. You can have rebleeding. An aneurysm that has leaked or ruptured is at risk of bleeding again. You can have narrow blood vessels in the brain. After a rupture, vessels in the brain may contract and narrow, which is called a vasospasm. So, like your blood vessels in that area or other areas are contracting, so it's really hard for that blood to flow through them. This can cause an ischemic stroke. So you've had a hemorrhagic stroke, and now you can have an ischemic stroke on top of it, because there's limited blood flow to the brain, causing cell damage and death. You can get hydrocephalus. The buildup of the blood from the rupture can block the movement of your cerebral spinal fluid, which surrounds your brain and your spinal cord, which can cause an excess of fluid to build up, putting pressure on the brain, causing cell damage and death. And it can also cause a change in your sodium levels. Bleeding into the brain, especially near the hypothalamus, can disrupt sodium balance, which is extremely, extremely important.
Especially in the brain.
Yeah, a drop in sodium can lead to brain swelling and permanent damage and death. So treatment for the different types of aneurysms. An unruptured aneurysm, they treat it based on the risk. Your age. Preventative surgery in older adults, usually the risks outweigh the benefits. So they do not usually do preventative surgery in older adults. The size of the aneurysm. If it's larger than 7 millimeters, they often treat it preventatively because that's too big. It's going to cause other problems.
7 millimeters is pretty goddamn big.
It's huge, yeah. The location of the aneurysm. If the aneurysm is on a larger blood vessel, they're more likely to rupture.
A carotid artery in your brain.
Right. They're more likely to rupture than being on a smaller blood vessel, so they would probably preemptively treat it. If aneurysm rupture risk is considered low, active observation is recommended. You'll be checked regularly. You may be given blood pressure meds to make sure your blood pressure stays in a good range. You'll be counseled on weight loss and eating less saturated fats to reduce your risk of high blood pressure and blowing the aneurysm. If preventative treatment is recommended, there are two main surgical techniques. It's neurosurgical clipping and endovascular coiling. Neurosurgical clipping, just like in the AVM, is brain surgery. You're under general anesthesia. You're put to sleep. They cut your skin. They remove a piece of your skull, which we say they'll take a flap, so they can access your brain. They're going to go into your brain. They're going to go into the area where the aneurysm is, and then they will put permanent metal clips on the aneurysm to seal it off. Then they put back your bone flap, close up your skin, good as new. Over time, that aneurysm will seal along the sides of the metal clips, permanently closing off the blood supply to the aneurysm. Sometimes they clip it on the aneurysm. Sometimes if the aneurysm is very large or like complex, they'll clip the artery further down instead of the aneurysm itself. If they do this, they can perform a bypass to reroute the blood flow, and they'll take like a little vein from your leg, put it in your brain to bypass that area for the circulation. Endovascular coiling, it's not a brain surgery. They're in your brain.
More common. I haven't seen a clipping in a long time.
I haven't done a clipping in a very long time because the coiling is much less invasive and it's a safer procedure. Right. So endovascular coiling, not a brain. Yes, they're in your brain. We're not opening up your head.
They're in your groin to your brain through your groin.
So they insert a catheter into an artery in your groin, and then they guide a wire up through all your networks of vessels till they get into your head, and then they get into that aneurysm. Then they deploy tiny platinum coils into the aneurysm so blood cannot enter it, which means it's sealed off. It can't grow anymore. It shouldn't rupture.
And it's clotted, so it's not, even if it ruptures, nothing's going through it.
You're not going to bleed to death out of it. Both procedures work very well. Just depends on the size, location, and shape of the aneurysm. But again, we are seeing a trend where we're going more coiling. It's just it's a less invasive, it's safer, it's quicker. If your aneurysm ruptures, you will require one of these surgeries emergently. Mm-hmm. So these are preemptive, but if it ruptures, we're doing the same exact surgery, but we're doing quicker. It emergently because the longer that blood stays in the head, the more damage it's going to do. Other treatments that you get when the aneurysm ruptures, you can get calcium channel blockers, which help reduce the effects of vasospasms. IV meds to help reduce ischemic strokes. They could do angioplasty with balloon to expand the arteries, or vasodilate. They can give you vasodilators through the angioplasty to help stop the vasospasms because you don't want an ischemic stroke on top of a hemorrhagic stroke.
Exactly.
They can give you anti-seizure meds. You can have a VP shunt, which means they go into your brain, they put some tubing in, and they tunnel it down into your belly. So if you're building up extra CSF, it drains the fluid off, so you don't have the pressure of that. They might give you a lumbar drain, which does like the same thing, drain some fluid. And you might possibly need rehab after, depending on the outcome of the blown.
However bad the strokes were, however bad the rupture was, as you're going to hear, the girl we interview, she was very fortunate with the lack of damage that happened, but not everybody is so lucky. It really depends on where it is, how big it is, how much it bleeds, how far you were. I mean, people coming from Maine or people coming from Revere. It really depends on so many factors.
Right. And honestly, I saw her scans. I thought she was going to die. I thought she was going to be dead.
Right.
I don't know how she's alive, to be honest.
She didn't look good when she came in.
No, it was not good. The cause of brain aneurysm or any aneurysms is unknown, but there's several risk factors that are known. They are more common in adults than kids. They are more common in women than men. Smoking is a risk factor. Hypertension is a risk factor. Drug abuse, especially cocaine, is a risk factor. Heavy alcohol use. Previous head trauma. And previous blood infections.
Interesting.
Yeah. Some conditions present at birth can raise your risks. Ehlers-Danlos is an inherited connective tissue disorder that weakens blood vessels, so that puts you at risk for developing aneurysms. Polycystic kidney disease puts you at risk because it increases your blood pressure.
Didn't even think of that.
Coarctation of the aorta also affects your blood pressure, puts you at a higher risk for aneurysms. AVMs put you at a higher risk for aneurysms. And a family history, especially first degree, it is not hereditary, but a first degree family history puts you at higher risk. So your mother, your father, your sister, your brother. You can lower your risks by stopping smoking, eating a healthy diet, moderate alcohol intake, maintain a healthy weight, exercise regularly, and cut down caffeine.
So a healthy lifestyle.
Healthy lifestyle. I mean, you can't, again, you're not going to stop yourself from getting one, but you could prevent it from getting worse, or your blood pressure increasing and then blowing the aneurysm, So, that's it on aneurysms. But
well, I have a funny little OR story about aneurysms that I'll share, and then we'll listen to Nicole. So back in my early days of scrubbing, I'm a brand new scrub, and you remember the surgeon we had. He was a nut.
Yeah,
and he was our aneurysm guy. Like, I must have gotten there just after he got out of residency, and he was there every weekend, all the time. He was there all the time. He was intense. And if he didn't like the staff that was on, he didn't operate. But if he liked the staff was on, he'd book 3 aneurysms. So I'm new to doing aneurysms. I'm in his room, and at the time, they took a very long time to do. You're in a dark room. The aneurysm clips, they're going in your brain, so they're not very big.
Right, they're very, very tiny.
teeny tiny, and you've got to loam on this needle holder in a certain way, and you can't see because it's fucking dark. So we're doing an aneurysm, and he would always pick his clips that he wanted. He'd be like, load this one, and this is my backup. Okay, I got them loaded, because I had time. And on the microscope was a camera, so there was a TV in the room, so you could watch what he was doing. So, unscrubbed. And he's getting into the aneurysm. And I will say, as much as I fucking hate neurosurgery, I hate it. I find it so boring. The aneurysms were cool because you could see.
Yes.
It was the coolest thing to see, right? So it never failed. It happened to me many times afterwards. I was much more prepared, but I'm watching, and all of a sudden the screen goes red.
Oh, God.
It had ruptured. Right as we're getting ready to clip it, it fucking ruptures. So when they are bleeding.
Yes.
He starts screaming at me to clips, and my hands are shaking. And I go to hand him the clip, and they're looking in the microscope. So he's just got his arm out looking, and the clip flew off the clip applier. Gone. I'm like, fuck. Not only does he need it, it's a countable item.
Yeah.
So he's like, give me the backup. Give me the backup. And I go to give him the backup, and fling, it goes flying off the thing. I'm like, shit, I'm sweating. I'm shaking. He is screaming at me. He's like, give me the fucking clips. So they were all on these like plastic pieces of paper. There's like 30 clips. And I hand him that, and he clips the whole thing. He's like, Jesus Christ, if you don't know what you're fucking doing, get out of the room. I'm like, they were on the OR light. They made it the top of the OR light. Well, I learned how to clip an aneurysm after that. Never made those mistakes again. And I was one of the people, if I was on, he booked 3 aneurysms. But wow, did I? Oof, that was the most harrowing experience of my life. I'm not gonna lie.
Those cases are very stressful.
They were timed.
When they're getting ready to go, you're like, okay, this is like it, because they bleed so fast, and the brain dies.
Anything on that screen, and to dump both of his clips. I can't believe he didn't strangle me. Right? Yeah, I can't believe I'm alive to tell the tale. Yeah. All right, so following up is Nicole's story. It's an amazing story, and we hope you enjoy it. And we will see you next week. All right, so we've covered aneurysms and AVMs. Yeah. And we have Nicole with us, who unfortunately 9 years ago, post-pregnancy, 4 days post-pregnancy?
I was 5 days postpartum.
5 days postpartum, as if that isn't hard enough, ruptured an aneurysm in her brain, not in her abdomen. No. So Nicole, tell us your story. Take us from the morning of the day it happens. What happens?
Sure. I will say first that I feel like this was one of the best things that ever happened to me in my whole life. No. I absolutely do. It gave me such a different perspective on what matters and what doesn't, and how
you hear people say that. You do hear people say that.
It like changed me in a good way. More positives than negatives, but it was not great, obviously. So I was 5 days postpartum. That day, my husband and I took our new baby to the pediatrician, had a great checkup. Went to Target to buy snacks and other baby things. Who knows?
I mean, it's a great place to go.
Target's the best. And then went back to our house. We had some visitors over to see the baby. And then that night...
so during the day, you're not feeling weird? Nothing?
Nothing. No, I mean, I just... had a baby, and that was kind of the trip. But I didn't have any headaches or any
dizziness or nothing.
No, like numbness or neck pain,
blurred vision,
none of that, which is like the traditional warning signs, right? So that night, our daughter was asleep in the now discontinued Fisher-Price Rockin' Place. And
why did it smother babies in their sleep?
Something bad happened. Like it really was. It saved us, like for sure. And I had said to my husband, like, "Oh, I'll stay down here in the living room with the baby while she sleeps. You go upstairs, get some rest, and like we'll just keep doing this, I guess." And he said, "Oh no, I'll stay down here on the couches with you guys. Let's all be together." And then we went to sleep.
Things my husband never said.
What I'm told is in the middle of the night, I made some noises, or I was holding a cup in my hand, or I fell or dropped something so much that it woke my husband up. And he is a trained EMT, and at that time he was a 911 dispatcher, and he knew that, he looked at me and saw that something was wrong, and he deduced that I was having some sort of neurological something happening. So he gave me CPR.
So you would hit the ground.
I hit the ground. Baby's still sleeping.
And you coded?
I
Like
don't
you
know.
went to cardiac arrest?
He doesn't talk about it, so
Okay.
I don't know.
Okay.
I know he maybe gave me CPR, maybe gave me compressions, or gave me breaths. I don't know. Like I said,
He was trying to revive you.
He was trying to get me to wake up, and I wasn't waking up. So he called 911, and they took me. He told them what hospital to take me to, and then he stayed home and called my mom. It was like 2 in the morning, 3 in the morning, maybe.
Call you never want to get.
It's awful. My mom came in, stayed with the baby. He drove to the hospital to see where I was at. And then I think at that point they had taken me they knew I had a ruptured aneurysm. They figured that out. They had me in surgery to try to repair it. And during that time, they had him in a waiting room, and they were giving him pamphlets of, like, he's had to sign all the papers, and those are hard papers to sign. And they said, if she wakes up, if she remembers, here are some facilities you might need to put her in. If she can walk and talk and feed herself, you'll be lucky. They gave him the statistics of survival rates for people in my position, and it wasn't.
You know what? I know they have to tell you all that, but I don't know if that's the time to tell you all that. Like, get you through surgery, and let's get on the other side before we start talking about outcomes. That's got to be rough to be hearing all that.
I imagine it was
Terrible.
Shell-shocked.
Yeah.
Like, you can't even absorb any information, let
Right.
alone make decisions.
Yeah.
Like, you're just there sitting and waiting. And it was a long surgery. I mean, I think I was in for like 6 hours for that first surgery, where they found that I was bleeding, figure out where I was bleeding from, and they put coils in to stop the bleeding, and then got me stable, I guess, and moved me to a critical care unit or an intensive care unit. You guys know better than me. And there I was. And I don't remember. Like, I have about a week that I don't remember, but then I remember coming out of it when they got me off the drugs and, woke me up. I remember looking up and seeing my brother-in-law and sister-in-law who don't live in state and seeing them in front of me. Yeah. And I remember thinking, like, oh, it's so nice that they came to see the baby. And that's the first memory I have. And then that kind of like fades away. I remember him bringing the baby into me every day so she could nap with me and be close with me. She was brand
sweet.
new.
Yeah.
I remember being angry. And my best friend called it. She said, Nicole's going to wake up and she's going to be fine, but she's going to be pissed off. And I was really, really mad.
What were you mad about?
I'm not sure. I just didn't want to be there. I just wanted to be home.
Yeah.
I didn't understand because I felt fine. In hindsight, probably I wasn't.
I was aware of the drugs.
But I just wanted to be home, and I didn't understand why they were keeping me here. And that's how it was in my head at that moment, that I felt trapped there. I felt like I want to leave, and they're not letting me.
Right.
And in fact, if I go through like my
That's how I feel every day at work.
That's fair. When I go through my text messages, like there were a couple of friends that I would text like a couple times every day because I wasn't really lucid. I was on the Michael Jackson drugs, but I was.
You were on designer drugs.
Like I was on some sort of drugs. But my text messages are like back to back. Be like, oh, I'm going home tomorrow. I'm just gonna get this drain taken out. I'm gonna be home in no time. But I would send like the same one to the same person like 6 times a day. How you feeling? Pretty great. They say I'm gonna go home like any minute now. I'm just like waiting for my papers. And my friends are like, no, honey, you're not going home.
Yeah. It's not happening.
To the point that like, even when I was in the hospital, I said like, I'm not going home. I'm not going to eat until you let me go home. I'm going to go on.
You're going to do the Gandhi on it?
Yeah, I was like, I am a virtuous person. Like I'm not eating. So what? Send me home. I'm not eating. And the nurses were very sweet. They had so much power. And I said, I'll only eat like honeydew melon. That's all I'll eat. I was such a brat. And they were like, okay, we'll get you that honeydew melon. And they sure did. Because they're like, the option is, Nicole, you either eat this honeydew or we'll just feed you.
Or two.
We can just like give you nutrition. and I didn't understand. I'm still grateful that they were so patient with me because I was not. I'm a very kind person, but I was not a good patient.
There's a lot of people, though, that I would not be a good patient either. And I sure as hell wouldn't eat honeydew melon.
You get humbled pretty quick.
I'd be like, you get me chicken nuggets or I ain't eating nothing. Yeah, it's hard. I mean, nobody's at their best at the hospital.
No. And modesty just goes right out the window.
Yeah, absolutely.
You have to surrender. And that's hard for someone like me because I'm very, very stubborn. But I feel like my stubbornness saved my life. So
yeah, absolutely. Mm-hmm.
There you go. And then, I was in that unit for a couple of weeks. And it was hard.
I know you had to go back for a second procedure. How far into your recovery was that?
Well, when I was initially admitted, I had the aneurysm, they coiled it, and then through that process, that when the swelling was reducing, or so, I had some vasospasms, which are like stroke-like events, that they had to bring me in for a surgery during that stay. And I feel, again, my poor husband, he was like out to dinner with his friends. And he was like, fine, like, everything's cool in the hospital. I'm going to take a night and just go out with my friends and, like, just feel normal. And they, like, called him mid-dinner, be like, oh, sorry.
He's never been to dinner since.
Pretty much. And so that was a second surgery I had. And I, people are surprised. I'm like, no, I remember all of it. Like, I can, if I close my eyes right now, I can see the surgeon. I see what his face looked like. I could identify him in a lineup. Like, it's so vivid to me. And that went well, and they reduced the swelling. Because every time the nurses would come into my room, and they would say, count backwards from 100, and be like, fuck you. Like, or they'd say, like, hold up both arms, and who's the president? And I was like, I don't, like, every 3 hours, like, leave me alone. You tell me to sleep, and then you're in here every 5 minutes. And I didn't understand it until the one time I couldn't do those things, and they were like, get her into surgery. So, after I was discharged, I went home, and there was an adjustment period for sure. I feel very lucky that I still had all my facilities and I could take care of my own body, and I could.
Did you have any deficits?
No.
That's really.
It's
amazing. Statistically
really unlikely.
Yeah.
There are things that are different about me now, after. Like my thought processing is different. Like the way I input and assess information is just different than it was before. My friends say that I'm more blunt.
Is that what happened to me?
Yeah, you've had a head injury. Apparently.
I've had a head injury. I didn't know that.
But I don't think that's like mapping back to like neurological changes. I think it just is like I don't have time
for the bullshit.
For the bullshit. I don't have time to
gonna
make small talk about the weather. Like I want real talk all the time because I don't like, and I'll take it. Like I'm into that. But I had really great doctors. I still do. They're very eager to cure me. So
because you're a light and a lot of darkness for them.
I can understand that now for sure. But a couple, maybe 2 or 3 years out, there was a new stent that they developed in Norway or whatever, and they're like, it's a mesh stent, and like that's what I needed. They're like, we have it now. It's approved in the States. Like, let's slap that in your brain in the most neurologically safe way. Slap it right in there and like patch you up, and then like you're done. Like you're cured. I was like, oh no, let's try it. And they got me in, and it was really scary going into that surgery because at that point my daughter was maybe like 3 or 4, and I feel like she's more affected by my absence then. And they couldn't do it. They got me in, and I was like in the surgical room, like ready. Everything was ready to go, and they like double and triple checked, and they noticed that if they had placed the stent where they needed to, it would have cut off blood flow to like a major portion of my brain. There was like a little vein like hiding behind something else that they didn't see the first like 4 angiograms they took, but they like double checked in that room that day. And my neurologist that I've worked with for years like called in his colleague, like called people from other hospitals to like look at this.
Yeah.
And they were like, you can't do it.
Thank God.
Thank God.
Thank God.
And
could you imagine like you come out of it okay and then they kind of make it better and it just makes it 10 times worse?
Out, yeah.
Holy moly.
And I remember when I woke up, there was he wasn't my doctor, but he was like a resident or someone in training. Again, you guys know the word for that. I don't have those words. But he was very handsome. I'll tell you that.
Well, that
much.
does narrow it down.
And he was the one that would always have to apply pressure to my groin post angiogram.
Nice. So awkward.
And I'm one like I'll make it awkward.
Yeah.
It's like
You're so hot.
and I'm on drugs, right? So like, how long did you have to go to school to like apply pressure to someone's crotch? Like, what's the training for that? So it was that guy that I saw when I first woke up from that, I guess failed procedure. And I just remember the look in his face, and I just said, like, I couldn't really talk because my throat was really sore from the tube, but I just said, what happened? Because as soon as I saw him, he had like tears in his eyes. He's like, we couldn't do it. And then later we found out why. And
so what does that mean for you, that if they can't do it, like, do you have to continue to go back for scans? Is there a chance it's going to happen again? Like, what does that mean for you?
Well, I had that same question to my neurologist when I went back after we went home that day, and then I went back with my mom to talk to him about that surgery and what happened. And I asked him that question. I was like, so what does that mean? Like, do I have like, are we talking, I'm in my head, I'm like, are we talking a year, 2 years?
It's my prognosis.
Like,
am I dying?
seriously.
Because I'm going to Italy.
And he just gave me a big hug and said that it just means that you get to be our patient for a really long time.
Well, that's good.
Which was a nice perspective.
Yeah.
And I'm really thankful to him because if he wasn't as experienced, he would have done it, and he would have killed me.
Mm-hmm.
And it takes a lot for someone to say, like, no, I can't.
Yeah.
And that's brave.
Yeah.
Right?
Yeah.
That's really brave.
That's a good doctor.
He's a really good doctor. A genius. I mean, bedside manner.
That's usually how it goes.
I find the ones with the worst bedside manner
the
are
best
the best doctors.
Well, it's so funny.
Because they're thinking constantly. They're so far above you. They don't have the energy to talk to you at a lower level.
And like, I say that I remember almost everything from after my first surgery to, when I first was admitted. But I was like not a great patient, and I'm not proud of my behavior in those moments. And then like later on when I had follows, my neurologist, I like went to his office, and he looked at me, and I was, standing and walking and talking, so way to go. And he's like, Nicole, I just want to tell you that I forgive you for everything you said to me when you were in the hospital. I know.
Like, shit.
He was like, I know that when people are in those circumstances, they might say and do things that are out of character. I don't take any of it personally. And I looked at him and I was like, who are you? Like, I had no memory of this human. Like,
you remembered everything else
accosted.
except for that.
I just blocked it out or something. But I was like, what did I say? I'm not. If you know me, I'm a very kind heart. Like, I don't say mean things about or to people.
Yes, but the circumstances you were under.
I was punchy.
And you probably don't remember, like you said, you don't even remember it.
It's wild.
A lot of patients will be horrible and they don't remember it. You can't hold it against them.
And when he looked at me, he said, I forgive you. I was like, hi, I'm Nicole. I had no idea.
And you are.
Yeah. But, after he tried to place that stent and he couldn't, I was scared because I didn't know what that meant for me. But I get now I'm on MRIs every couple of years, but I would get angiograms almost every year for a while, and I think I'm due for an angio this year, or maybe next year at 10 years out. And they go and they check, and nothing changes, and they don't smoke, don't drink, keep your blood pressure down. I'm like, oh. You can only
do what you can do.
I do all those things.
So you had mentioned after you went to support group.
I did.
Tell me about that.
So when I was in the hospital, I had just had a baby. So there's a risk of postpartum depression, I think, we know that now more than ever, right? And then also there's a increased risk of comorbidity and depression for people with brain injuries, like either acquired brain injuries like I had, or traumatic brain injuries like a concussion. The symptoms are pretty similar between those two piles. And depression's always pretty high up on the list. So they were giving me a lot of pamphlets and a lot of depression screenings in the hospital. And it was recommended to me by my neurologist and also my therapist to go to a support group. So I did. It was at the hospital that I was taken care of at, and it was really, really hard for me because I was in those spaces. Whenever I'm in a space with the brain injury or brain aneurysm folks, people never assume I'm a patient. They always assume I'm a nurse. That's like helping with volunteering, whatever. So in that space, that was the assumption. Like, oh, where do you nurse? Like, where do you work? I'm like, oh, I work at a university down the street. Like, I don't work here. And it was really hard for me to be in those spaces because a lot of the other brain injury survivors weren't as lucky as I was. And it was hard for me to see that. It was hard for me to see people walking with canes or walkers or needing people to drive them to the meetings. And I like would take the train there and then like go out for coffee after. And the problems that they experienced, while it was like reassuring to know that they had similar, I do have some deficit and they're minor, but it was cool to hear that other people felt the same way. But these people were kind of fucked and I'm not. And it was really hard for me to think about why. Like, why did I survive and other people didn't?
What was your survivor's guilt? Like, what is that all? Not that I don't know what it is, but
sure.
Like, what were you feeling about?
I was feeling that, I was feeling really lucky and really privileged that I was given the chance to survive and other people weren't given that chance. And I didn't feel, at that time, like worthy of that. Right? Like, why should I survive? And like the person in the room next to me doesn't get to. And it was very, very, I felt very guilty that I could cook dinner for my family and pay my bills and drive myself around and take care of my kid and like bring her to like story time at the library. And like other moms that this happens to don't get the chance to do that. And I felt just really guilty about that. And like nothing I could do would make that go away, that feeling.
So has it gone better now? Yeah.
Yeah, I think I feel it less. Because I'm realizing that everyone has their shit, right? And some people just mask better than others, but everyone has stuff below the surface. And the older I get, the more I realize how true that is, right? And your perspective matters more than anything. So for me, like, I do feel really lucky. And that's okay. And I am worthy of survival. I am worthy to be here. And that's okay. It's also helped a lot that I do volunteer quite a bit with the Brain Aneurysm Foundation. They're a really great organization. So I do a lot of like information sessions and tabling events for them. September is it's Brain Aneurysm Awareness Month. And I work with the Brain Aneurysm Foundation to like help with like policy measures in Washington to try to get reform and awareness. Brain aneurysms affect 1 in 50 people and we never talk about it. It's never part of the conversation. And it's a real thing that people have described it to me as God's sniper that just like takes you out. And I feel lucky to have dodged that.
How long would you say from the day it happened till you felt normal again? In relative terms, like, I feel like this didn't happen to me.
Well, it's been about 9 years and I'm not quite there yet.
All right. So never.
I think of it every day.
Yeah.
But now I think of it like with hope and with optimism. But right away after, for a couple of years, I didn't. I was mainly just worried about my kid because she was so young. And right after it happened, my husband went back to work and I was home and I was on FMLA for work and I was home it was great to have that time with my new baby, but it was really scary because like, what if? Like,
what if I just drop?
What if I just drop? What if I'm walking with her in a stroller down the street in traffic and I just drop dead? And that took a lot of therapy to get over that. And now it's better because she can advocate for herself. Like, it's been about 9 years. She knows my phone number, right? She knows how to call 911.
Did you teach her young, like, how to call 911 and this is what to do if you see this happen? I would be, like, hyper-vigilant for that.
She's got a healthy sense of that for a kid her age more than most, both from my experience and my husband's profession. Right. Like, working in public service as a public safety person, where we're doing real talk a lot in our household. But she still doesn't know the details of like what happened when she was born. She knows that I was sick. She knows that I was in the hospital.
Will you ever tell her?
I'll have to, because she'll have to get screened at some point. But I'm not going to get her screened until she can advocate. She can consent.
And I would think if she ever gets pregnant, you're going to be a nervous wreck.
Oh, yeah. Every time she says she has a headache, I'm a nervous wreck. but I'm trying not to.
I have a headache. I'm like, oh, this is it. I just said for the other day, I was dizzy. I'm like, my cat crawled up on me and I was dizzy. I'm like, I have a brain tumor. I'm dying.
Yeah.
She's like, you're not. I'm like, no, this is it.
So I talked to her doctors and I say, like, when should I start screening? But I'm kind of glad that I never knew. I am.
Right.
Because I would have been a wreck all day.
Right. It doesn't hang over you every day.
I don't want to put that on her. It's not my place to do that.
Mm-hmm.
But when she's old enough and I can educate her more about it, she can make that choice. It's not my call to make for her.
Right.
But yeah, there was a lot when she was a little baby because she was so vulnerable.
I totally understand that.
Mm-hmm. And I don't think I'm almost over it. I'm almost there.
I don't think you're ever going to get over it.
I don't want to.
I don't think it's not something this is part of who you are now.
And like I said at the start, like I'm very, very, I'm thankful for my doctors. I'm so, like, to say I'm thankful for my nurses is an understatement. They, like, doctors saved my life, but the nurses, like, saved my soul for sure.
They need to hear that.
Nurses I got to tell them. I was really cool. As one of the support groups I went to, the reason I went that day is they were taking a tour of the unit I was on. And I wanted to, like, wear an outfit and I wanted to like strut around and I wanted
to be shaved
like
and look pretty.
Yeah, because the last time I was there, like my bum was hanging out and like they were like pumping my breasts and like it was just like like the nurse's station like in the fridge was like my breast milk. So I just wanted to like put some lipstick on and like wear a shoe and just walk around and like not have my bum flapping, right? And the skid socks, right? Gosh. Socks. And that day for that tour, some of my nurses were working and I remember them. I remember their names and their faces, like they're burned into my brain. And one of them, I saw she was working and I kind of left the tour, which I got yelled at later for, and like went and like tapped her on the shoulder. You should have said, I have a brain injury.
I don't remember.
I do it a lot. Yeah,
I would use that all the time. Head injury.
It's really tempting, and I do pull from
my husband's got deaf in one ear and he uses it all the time. I'm handicapped. I'm like, oh, please.
But I went to this one nurse, and I kind of came up behind her and just put my hand on her shoulder and said, oh, excuse me. And she turned around. I was like, I'm not sure if you remember me. And she looked me right in the eye and she just started crying and gave me a big hug.
Oh, you're gonna make me cry.
She was like, are you okay? How are you? I was like, she's like, how's the baby? How's your mom? How's your dad? And I was like, we're fine. Like, we're fine. She's like, I think of you all the time. Like, I worry about you all the time still. I was like, no, we're okay. And
because we all have those patients that remind us of us.
Yeah.
You know, we were all young mothers once, and something happens when you were a young mother, you stick.
Yeah, I'm so thankful. And I realized that I remember when I was walking around the unit when they made me walk around, which I hated. Like, you gotta move. I was like, I don't want to fucking move. I'm tired. My head hurts. I remember there were flowers all everywhere, and they were like, they're all for you.
Oh,
I was like,
wow.
What? I was like, why can't I have them in my room? They're like, because you can't have, you're in the ICU. You can't have flowers in your room. But like the nurse's station was like covered.
That's so sweet.
It was lovely. And I remember I don't remember, but like the first day I was in and they woke me up, I guess like a bunch of my friends were like waiting for me to wake up. They're like eating bagels in the lobby, like having a little party together. It was like this beautiful atrium space in this hospital, and they were all like there partying. And my sister-in-law's a nurse, and she said to my husband, she's like, you got to get all these people out of here. Like, because she'll wake up, but she's not going to like
be partying bagels with you.
Yeah, she's not going to want to hang out. Like, she's going to be pretty fucked. Yeah. And that was the truth. But it was just nice to have all that support.
What are your words for people who either just found out they have one, don't know, like are recovering from one?
Well, I can't really speak to like what to say to people that just found out they have one. I imagine it's a real burden to carry. You feel like people have explained it like you feel like you have a time bomb ticking in your head. And I'm so glad that I didn't have to carry that. I wouldn't have been able to handle it. But people in recovery, what do you say? I wish I was kinder to myself. I wish I didn't try to get right back to like the hustle, because I'm a hustler. Like, I always work hard, I work fast, I move quickly, and I had to slow down. And that was a really good lesson. That was a healthy lesson for me to learn. But I beat myself up a lot. And I compared, and like all new mothers, right? You compare yourself to the mom next door and what she's doing. But like, I don't, right? But
now you look at it and know it's Facebook fake.
Well, now it's all Facebook fake, right? But at that time, I wish that I had gave myself a little bit more grace and like didn't feel guilty about needing to sleep so much. Like I had to sleep a lot. Right after recovery.
Every head injury, you need. That's all you can do. Yeah.
And like I had to. Yeah. It's very hard when you have a newborn to try to do that.
Yes, it is.
So I think that process took me a little bit longer. Is that compassion and that kindness and like the understanding that I am worth it and it's okay if I need to go slower. So I would just give people that advice. It's so silly, but like drink water, get sleep,
take care of yourself.
Take care of yourself, right? And I do. Mostly.
It's hard. You're a mom. Yeah. Your wife. It's hard.
I don't know. It's a really hard question. Like, what advice would I give other people? I don't.
So you still work with people like the foundations?
Yeah, I work with them as much as I can. I have a full-time job that I teach psychology to undergraduate students, and this comes up a lot. Like I teach health psychology classes, and we talk about the sense of self post-illness or how you kind of quantify your personality when you talk about chronic illness, because this is a chronic invisible illness that I carry, and it does change how I perceive myself in the world. So it's kind of cool to have advocacy in those spaces and like, you know, talk about these concerns in those spaces to help kind of inform and educate people about it. I think it's really nice to do. But yeah, I'm involved with the Brain Aneurysm Foundation. And do as much like kind of policy work as I can. I do like tabling events at the hospital I was at every time they have them, which again, they always think I'm a nurse and I just sit and they like, you know, take a picture of all the brain aneurysm survivors and they like tote me out front and center. Like,
no, look at this one.
Best survivor ever.
Look how good we did with her.
Right, no, that like is the vibe for sure. Like get Jerry in the back. Put Nicole up front. Like, she's
keep the canes in the back.
She's got an outfit on.
She put lipstick and shoes on.
Yeah, she's going to work later. So it feels great to be able to do those things. I wish I had more time and bandwidth, but I'm kind of starting to feel more normal, like, which is great. Yeah. I still get headaches.
Only took 10 years.
Almost 10 years. I still get really tired, like really tired sometimes, that I have to stop and sleep.
Do you get tired after like a stressful event or like something that would really make you have to hyper-focus?
Yeah, I get tired after I look at a computer screen for too long.
I believe it.
And I think that's really common with brain injuries. It's that type of stuff that is like, you can't see it on a blood test or see it in a brain scan. Right. But like if I'm in a social situation for too long, I get like my social battery just gets really depleted. I have a pretty, the hardest thing for me is like sensory sensitivity, which is also really common post-brain injury. Like if I'm in a place that has like bright flashing lights and really loud music, or like sounds that are just repetitive, like a kid whining at you over and over again.
I have that too.
Yeah.
Me too. In the lights and loud noise.
It like scratches at me in a way that it never did before, and I'm not sure how much is like.
Sure, that's just not aging.
No, that's what I don't know.
There's
like
a
where
reason
the line
you don't see 40-year-olds in a nightclub.
Well, it's so funny because I like go out to concerts a lot, and my friends make fun of me because I'm like, I'll have my earplugs in and sunglasses on. And like big heavy clothes so people can't touch me.
Yeah, that's beyond being old.
It's I can still do it, but I need to make accommodations for myself, and I'm
you
trying to
still
do
it. That's what it is.
I
you
for
will
sure
still do it.
I have to, or I need. That's a big part of my personality, and I'm not giving it up. But I've learned to make accommodations for myself unapologetically, because who cares,
right?
You know.
Yeah. Well, that's it. Who cares? It's about you and nobody else.
Yeah,
you're gonna do what works for you.
And I think that getting older has helped me with that piece. Like, you know, I don't care what other people think, and like maybe 10 years ago I would have.
Right, you're not going to be 28 going into a club with earphones and sunglasses on.
I'm facing a really big number this year. And part of that I love about it, I don't give a shit about nothing anymore. Go ahead and make fun of me. I don't care. This is what I'm doing. My knees hurt. I'm not jumping anymore. I'm not doing that. I don't care what you think of me. I'm wearing sweatpants, you know, like.
Yeah, I think that's really cool about being allowed to get older.
I almost wish, though, we could feel that way in our teens.
Yeah.
When you realize, when you have the body and you're beautiful and everything, and you're like, you're so worried what everybody thinks.
Yeah, I have those moments that I think of like 20-year-old me. I'm like, oh.
I know. We all have those moments.
That was the prime.
Where's that body?
And I hated it. I hated every bit
of it. I thought I was fat.
Oh my gosh.
Size 7.
But yeah, I went to like therapy for sure. Because I was like, I'm obese. They're like, you weigh 95 pounds. So no. Yep.
But now I'd give anything to have that body back.
Same. So perspectives change. And this really, I mean, it sounds so cliche, but I do think that it's the best thing that ever happened to me. Because every day, even on the shit days that you're like, my kids drive me crazy, work's driving me crazy, like life is just too much. And there are days like that, we know. I like think back. Honestly, I think back to one moment I was in the hospital and all I wanted to do was go home. And they said, cool, you can go home when you can walk up a flight of stairs. Because that's how they test you, right? To make sure you're okay.
They just didn't tell you the flight of stairs were,
Well, it was tricky. And I was like, yeah, I'll fucking do it. Like, bring me those stairs. I'm going to do it. Like, tie my thing shut so no one sees my bum
Give me my
anymore.
nose kids.
Like, get me my socks. Wheel me over. I'm going to do it. And I stood at the bottom of the stairs and I couldn't fucking do it. I couldn't do it. I took like 2 steps and almost like passed out.
Yeah.
And I was like, oh, I'm fucked. Like, that's
when
when
you don't realize what a hospital stay does to you. I was in the hospital at 19 for like a week. I was very, very sick. And I came home and I went to run up the stairs. I made it 3 stairs. I was like, Jesus. And I like literally sat. I'm like, what is wrong with me? It takes a lot out of you.
Yeah. And like my core was shot, like, cause I just had a baby. I just had a baby. And then I laid in bed for 4 weeks.
Right.
So, but that moment of like being at that foot of those stairs and I just couldn't get my body to do what my mind wanted it to do. I pulled so much strength from that moment. I'll tell you, like, there are some times that like we all do hard things. Life is hard. But I think like that was a time that I failed, that I had this hard thing and I couldn't do it. And I still kept trying. And now, like, if I'm faced with a hard task, I like think back to that moment of like, that was the hardest. That was the hardest. That was your Everest. Yeah. And I couldn't do it and that's okay. So I find a lot of power in that. And that's what I'm choosing to hold on to that. But it does come back, right? Like the feelings come back. So sometimes I'm in the supermarket or right after this injury, I would be in the supermarket and like the way the lights were, because they were really fluorescent lights that like reminded me, I guess, subconsciously of being in the hospital, and all the beeping of like the checkouts would like trigger the panic attacks, and I would have to like take my baby and just kind of run out of the store because my fight or flight instinct was like off the charts. And when I was in the hospital, like my fight or flight instinct was really amped up. And even now when I go in, they must have written something in my chart because
I'm afraid of hospitals.
that I'm a runner. Because they'll always, like, even for MRIs or angiograms or even whatever, they'll come in, they'll like talk to me about the procedure, and then they leave the room and they come back 2 minutes every time. They come in 2 minutes later and be like, actually, we're gonna have to, and then they like strap me down or something for the angiograms. Yeah, they really like make sure I'm in there.
Didn't you pull something up?
Yeah. So I have
so I broke the MRI.
No. When I was in my head thinking that like I was being held in the hospital against my will because of ICU psychosis, I'm saying, I was like, I'm just leaving. Like, I'm done. I'm just gonna, I can see my stuff. Like, I'm just gonna get my shoes on. I'm just gonna go.
My nose kids.
Yeah, like, it's fine. I'm just gonna get on the blue line and just go home. So I ripped out my A-line and I was just like, I'm leaving. I'm just gonna take this out.
Which is a catheter that goes into your artery in your wrist.
Right,
so
my wrist.
That's when blood goes all over the wall.
Yeah.
And yeah, not ideal, not directed. And this poor nurse, he was like 12 years old. And he walked by my room. Like, he wasn't my nurse, but he just walked by.
He saw you sanguinating in the
And I was just like holding my wrist. He was like, are you okay? I was like, no, I'm fine. And like blood was like spurting out of my wrist. I'm just trying to like
get hit the eye. Oh, yeah, no, I'm good.
So they must have labeled it somewhere in my chart that like I'm a flight risk or I can't be trusted, because now every time they like give me a lot of meds to help me feel sleepy. Mm-hmm. And the weird anesthesiologist always tells the same joke, and it's just like an awful joke. Oh, no. It's like, here comes the tequila, and it's like, that's not funny. Like, I'm getting my brain scanned right now.
Not funny on the 20th time.
It's like, and it's always the same guy, and I don't like him. I'll just say that. I'm not a fan.
Okay, you can ask for somebody else.
I did.
Oh,
yeah. And I even like I'm not going to talk about it on the podcast, but I like escalated.
Okay.
Like, it was really cool. I'll tell you later. It was like really cool to do. So like that's a lingering, people say, oh, you have no deficit, like you're doing so great. But like, the panic attacks at the grocery store, that's a deficit. Mm-hmm. Or like I would go to the hospital for follow-ups and like the smell of the soap that they use at that hospital would make my heart start racing, just the smell of it. And like, our senses are so connected, right, to our memories. And it would just, ridiculous. So it would just kind of bring a lot of that stuff back. And then other like there are weird things. Like some days if it's really rainy or if the air pressure drops suddenly, I'll like burn everything I cook. Like I just can't make it happen. Like I'll be trying to make dinner and nothing works. And now my husband was like, oh yeah, no, it's raining today. So we're just going to do takeout. Yeah, we're just going to get pizza. And I always thought like it makes no sense. But you had asked about support groups earlier and if I got anything out of it. And one of the biggest things for the support groups was just finding validation in those moments. Because at the one I went to, we went around the room and talked about like challenges that people had. And people were like, oh, I'm having a challenge like going to the bathroom on my own. Or I'm having a challenge paying my household bills. And, when I was like, I'm having a challenge like burning toast every time it rains. And because I didn't know what else to say. It was so awkward. And they were like, oh, yeah, no, that's normal. Like, us too. And I didn't, like, understand. I was like, what? Like, that can't be. But I guess it's a thing. And then, I'm a teacher, and my students notice things in me that I didn't even notice in myself. Like, sometimes when I would write on the board, it's like maybe a year or two out, I would always start at the middle of the word and like work around that first letter.
Build it out like a circle.
To like build it out until I was left with the real word. But at the time I was also like talking to students and like talking through the concepts. I wasn't really like, I was kind of on autopilot just writing on the board. I didn't realize I was doing that. They said, "Yo, professor, like, why do you do that?" I was like, "Do what? Like, what are you talking about? Like, why do you write so weird?"
They probably thought it was some sort of psychological test on
them.
Yeah,
you were screwing with them. Here's the O. Where's the rest of the word?
Maybe. I don't know. And they had to call me. They called me out on it. They were like, you start at the middle of the word and you work your way out. Like, what are you doing? I was like, oh, I don't know. And
I'm going burnt toast too. I don't know.
Yeah, and it's kind of cool. I don't know. I think it's really cool to like have this thing, this bit about myself that I just keep in my pocket. Mm-hmm. And you would never know. If you saw me walking down the street, you would never know. I have like, I'm fine. You look at me, I'm fine. Mm-hmm. Right. But I think that that's a really good lesson to share with people, that you never know what someone's gone through unless they make a choice to share it with you. Mm-hmm. Right. So I get to, in those moments in the classroom, I get to like pause and use it as a teaching moment to say like, yes, I know I do that sometimes, and this is why. And this is also like bigger picture, why you just need to be kind to everyone you meet.
Absolutely.
Because you never know what shit someone's carrying around.
Yeah. Absolutely.
So I think that's
like,
one of the
subscribe, rate, and review
all this is just
the Scissors and Scrubs podcast on whatever podcast app you listen to us on.
Until I
follow us on Twitter, Facebook, and Instagram at Scissors and Scrubs.
What are you carrying around?
Right. Like, and email us any of your stories or thoughts to scissorsnscrubs@gmail.com.
Really beautiful, and that's what I'm making a choice to take that away from this experience. Mm-hmm. And I'm so thankful for it. I'm so thankful for being alive and getting to be a mom to my beautiful daughter every day, even on the bad days.
Even in the preteen years.
Well, we're coming. It's happening, right? So
it's happening.
It is happening. Like, we're on a precipice in our household of like something that might not be great. But
let me just warn you. It's going to get rough the next couple of years. It'll get better, but it's going to be rough.
Well, I heard a great analogy that like for kids, it's like you kind of launch them out and they're off to the moon, right? And then like for a couple of years they go to the dark side of the moon and you can't really see what they're doing. Mm-hmm. But then they come back, right? And you see them again. You just start dialing back into them again. And she's launched. She's
on the trajectory.
She's getting there. And like, I know it's development. I teach developmental psychology.
Doesn't mean
I know
anything when that kid's hissing at you.
Ooh. Yeah. And I'm not Laura, you've known me for a long time. I'm not like a rage person.
No.
But
they know how to push your buttons.
Ooh, it is like blood boiling.
Yeah.
And it's not, that's not my personality.
Mother coming out like, what did you just say to me?
And I can like see my mother in my eyes sometimes.
Yes.
And like, I love my mom. She's like a very formidable woman. But I don't love that.
Yeah.
So, but
I had heard once it's like holding a frayed wire that's sparking at the end, and you got to hold on so they don't hurt themselves.
Yeah.
That's, you try to guide them and help them. It's teenage years is something.
But like every day's a gift.
That's
what
But you get to do it. You get to go through it. So.
That's what people tell me. You're so lucky. Every day's a gift. I was like, really?
Is it though?
Because I'm just trying to make some fucking toast.
Right.
Without burning it. So. Well, Nicole, I want to thank you for coming on and telling us your story. It's not an easy story to tell. And I guarantee you will get emails saying something like, my mother had this or something. I'm thanking you for it's people need to hear these stories because it's not often you have somebody that close to you that can tell you something like that.
Yeah. And like I'll say again, like 1 in 50 people have aneurysms, right? And they're very treatable. And preventative care is really important in these moments. And if you have a family history, you should go get a brain scan, especially if you have migraines or other sorts like sensitivities that you can't explain. Like, it's easy to get a scan. It'll save your life. So.
And it's the Brain Aneurysm Foundation. That's what it's called, right?
BAF.org is, I think, their website. They have really great discussion forums, really great events, like either philanthropic events or they do a lot of policy work to try to get some reforms and just to get awareness to everyone that needs it and access to this great care. We're so lucky in our region that we have access to really, really great hospitals. And I always think, like, if I lived in rural Maine and this happened, I wouldn't be here.
Well, you would have had to travel. They would have shipped you down here.
I wouldn't have
just
made
tacked
it.
on an hour, 2 hours to your treatment.
Right.
Yeah. I mean, statistically, it's really unlikely that people even make it to the hospital.
Exactly.
So,
exactly.
I feel pretty blessed and pretty lucky. So, and thank you for your nurses. And thanks to your nurses. For their great care.
They do a good job. It's a hard job, but they do a good job. So again, thank you. And we will see you guys next week.
Bye.